When breast cancer strikes a family, each story is unique, but our next guest has a pretty incredible tale to tell.
2 years ago, Lisa J. Davis lost her 51-year-old sister to ovarian cancer. Last year, Lisa found out she was genetically disposed to not only ovarian cancer, but also breast cancer. That's when Lisa sprang into action. So this is Lisa, closest to us, and her plastic and reconstructive surgeon, Dr. Lisa Cassileth, the double Lisas.
Good morning, lady.
Lisa, we want to thank you for sharing your story. Absolutely. You decided to take, by some standards, incredibly drastic measures when you found out that you were predisposed to this. Tell us what you did.
I had what they call a prophylactic double mastectomy and one-stage reconstruction that Dr. Lisa Cassileth invented.
So let's talk about the first part. You had a double mastectomy.
Yep.
Even though you didn't have cancer.
Right.
What made you do that?
Well, okay, so I have to backtrack a bit. You did talk about my sister had died. She passed away from ovarian cancer, and she had a 7-year battle. And it was grueling, and it deteriorated her body, and I watched it firsthand. So before I ever even knew I had the gene, I didn't know that breast and ovarian cancer were linked. But I remember saying back then to a friend, if I could get everything gutted right now, you know, all my reproductive organs, I would do it to not have to ever go through that. And then I found out I had it, so when they, you know, advised me, I was like, okay, get it out.
So, Dr. Cassileth, I want to ask you, for other people that know that that risk runs in their family, before you even have it, to go ahead and kind of remove your breasts and ovaries, is that something that you would recommend? Is that something that's a little premature to do?
Right, so if you have a history, your personal history, or you have a sister, a mother, a grandmother, an aunt that has had breast cancer or ovarian cancer, what we recommend now is to get yourself tested, because many of these women carry a gene that predisposes them to having cancer. Now, the beauty of it is that if you know you have the gene, then you can never have cancer at all. You can have the potentially dangerous area removed, and then you never have to endure chemotherapy, the other things, potentially dying of cancer, like her sister.
That gene is called the BRCA, is that
the BRCA gene?
BRCA gene.
That you've got it, exactly.
And is there a statistical correlation? Would you suggest if you have the gene, you have an X, or is that
exactly? So if you have the gene, you have over your entire lifetime up to an 80% chance of getting breast cancer.
Wow,
and it's not even run-of-the-mill breast cancer.
Sure.
It's usually a more dangerous type.
So then the other part of Lisa's story is what you mentioned, is that I've always wondered why this wasn't just the case. So you go in to have your surgery, you have a mastectomy, but then Dr. Cassileth, you perform a reconstruction during this, well, essentially the same
same surgery, right?
Amazing.
Yeah. So what's standardly been done is that, you know, doctors make a big cut across the chest, and so, you know, the effects can be pretty deforming.
Sure.
So what we've developed is specifically for these and small breast cancers is almost a breast augmentation-like incision. Take the entire breast tissue out through the small incision, leave the nipple and areola. I say that on television.
You absolutely. You're a doctor. You can go there.
It's technical. And then place an implant at the same time, so when you wake up from the surgery, you have a complete breast reconstruction, never undergo that deforming potential result.
So, Lisa, how do you feel now that the surgery's been performed? And I know this is really emotional for women, because that's such a part of your body, of who you are as a female.
Absolutely.
You know, I feel great. I feel so much better. Before the surgery, I felt like I was kind of a ticking time bomb, even though just because you have the gene, doesn't mean 100% of those people get cancer. I felt like I alleviated my risk. That's, you know, when I was at Cedars and they were telling me in the genetics counseling office, they said if you do the drastic measures, you actually decrease your odds, so you're below the regular population. So my risk is lower now than regular population.
My goodness, this has been really interesting. We've been following your story for a bit. Lisa J. Davis and Dr. Lisa Cassileth, thank you so much. Lisa, you're a very brave lady, and thank you for sharing your story. Dr. Cassileth, thanks for helping so many women with such a personal and intense battle. For more information on reconstruction surgery and gene mutations specifically as well, because we want you to be informed about that, visit drcassileth.com or lisajdavis.com. It is J-E-Y Davis.com. We posted all this information on our website, don't you worry. Lisa and Lisa.
Thank you, ladies.
Really a pleasure. Thank you so much.